The next topic I'll talk about is consent, and this is actually kind of important and a little bit tricky at first, but I think you'll get the hang of it pretty quick. So consent is permission to treat the patient. This is obtained from a conscious patient before assessment, treatment, and transport. There are 3 different types. There is expressed consent, and this is where the patient says yes. They speak it, or they give you some indication, they nod. They give you their arm to take a blood pressure. Implied consent. This is when the patient can't speak, the patient can't communicate. So patient can't communicate. Oops, that's an M. And this is basically where we assume that the patient would want care. Now, so they can't communicate. The other thing that they may not be able to do is provide consent. There are some rules about who can provide consent. Minors, for example, cannot provide consent. We treat them under implied consent. The last one is involuntary consent, and this is primarily for mental health and for criminals. People who are under arrest and are not able to consent to care on their own, the police officers basically have the right to consent for their care. So let's talk about this more specifically. Expressed consent, this is spoken or somehow communicated consent. Here's the thing, this must be informed. So if you're going to check a patient's blood sugar, for example, you have to get consent for that. And the way we do that is we explain what we're going to do. Sir, I would like to check your blood sugar. I'm concerned that it may be either too high or too low. The procedure involves a little bit of pain because I'm going to stick your finger to get a drop of blood. But I think that this test would be good. It's going to help me treat you better. So you basically have to inform them of the risks of not receiving the treatment. If you don't allow me to check your blood sugar, I don't know that I will be able to treat you as effectively. The adverse consequences, if your blood sugar is low and I don't know about it, you could go into a seizure. You could go into a coma, have a seizure, and you could even die. And then any benefits from it, you tell them, why am I doing this? And if there are any alternatives. Maybe, I could give you Tylenol for your headache, or I could give you Motrin for your headache. What are the alternatives? Usually this isn't about specific treatments. This is more about transport overall. When you're talking about single specific treatments, patients will generally consent, but still you need to know and understand what are the risks of whatever procedure I'm doing. What are the risks of not doing whatever I'm doing? Are there any adverse consequences? You have to know this because your patients are going to ask. So who can give expressed consent? Well, a patient of legal age and is rational, so they are of sound mind. And we'll talk about how to assess for that. If they're married, regardless of age, if they are pregnant and the consent of care is for the fetus, if the mom is consenting for care for the baby who is growing inside her, if the patient is in the armed services, or if they are an emancipated minor. So what exactly does emancipated mean? Well, this could be a court document. Some minors go to court and request to be emancipated and allowed to make their own legal decisions. It could be, generally speaking, if the person is living on their own and managing their own finances, regardless of the source of income. So regardless of the source of income, they're able to manage their own finances. This isn't a standard definition, but this is one that's fairly commonly used. If they're living on their own, they're managing their own finances, they can generally consent for care. Consent's a little bit easier than refusal because consent we consider generally to be beneficial to these people. So consent's pretty easy. This helps us with the college students. So if you're living on your own, you're managing your own finances regardless of the source, like most college students do, then you are generally able to consent for care. Implied consent. So basically the patient is either unconscious or unable to communicate and is suffering from what appears to be a life-threatening injury or illness, or potential life-threatening or injury or illness. And this is the key part here, is the potential for life-threatening injury or illness. As EMTs and paramedics, we can't always determine whether whatever they're suffering is going to be life-threatening. So if it's potentially life-threatening, which many injuries could be potentially life-threatening. So that really gives us a good blanket coverage for consent with these patients. What happens here is we assume that the patient would want to be treated. And like I mentioned earlier, this is generally how we treat minors and any patient who's unconscious. And the last type of consent is involuntary consent. And this is an adult patient who is being treated against his or her will. This is only if treatment is ordered by a magistrate, which is basically a judge. Treatment could be ordered by a peace officer or a corrections officer who has the patient under arrest or in custody. This is also what we use for consent of the mentally ill patients. So in the state of Texas, basically if a patient is suicidal, so if they make a threat on their lives, we are able to take them against their will to receive treatment for the mental issue that's going on. So patients have the right to refuse any treatment, and they have the right to refuse transport, but they have to be legally able to do so. They have to be awake, alert, oriented to their surroundings. And here's the other thing. They have to be informed of the injury, illness, risk, benefits, treatments, and alternatives. And what's more important is that we have to document that they understand the injuries, risks of refusing treatment, the benefits of treatment, the treatments that are available, and any alternatives that they have. So you have to document all of that and their understanding of all of that. Then you want to obtain a signature and get a witness signature as well. But to be honest, the big thing with this is going to be documentation. If your patient wants to refuse, your document better stand on its own. And it needs to include, A, that your patient is legally able to refuse. So it needs to make sure and include their age, date of birth, that they're awake, oriented to their surroundings, and that they understand what's going on around them. I like to put them through a few sets of questions. The question that I usually start with is, name, what's today's date, who's the president, what city, state are we in, and then I move into some trickier ones. I'll go, how many dimes in a dollar? Also have them count backwards from 100. From 100 by sevens. This one's tricky. So you try it now. Count backwards from 100 by sevens. So you start with 100 and then it's 93, 86, 79, 72. And you keep going. Have them go down until they get to about 50. The ability to do this tests several aspects of their brain. Assuming that they are able to do math, they should at least be able to get a few of these. Another thing that's actually really good to have your patients do is give them a circle, draw a circle in a piece of paper for them, give them a pen, and ask them to make this a clock face. So have them put the numbers in the right place and in order on the clock. So 12, 1, 2, 3, 4, 5. Have them go around like that. And you should really look and see, most of them should be in about the right place. And if they can do that, that's another good indicator that a lot of their brain faculties are working effectively. So those are some good tests. Another one, have them spell the word world, W-O-R-L-D, and then have them spell it backwards, D-L-R-O-W. So that's another good way to kind of get an indication of where is your patient mentally right now. So you do all those little tests, and you can basically document that your patient's mental faculties are reasonably intact. So what happens if your patient is trying to refuse, but you really think they need care? Maybe they're having some chest pain. Maybe you're concerned that they're having a heart attack. Well, in this case, you can get help from other family members. You can ask law enforcement for help. You can ask a supervisor to come out. You can call the patient's personal physician. That's a good one. First off, their personal physician doesn't really like to be interrupted from their workday. And second off, if you're calling them, the personal physician is probably going to tell them to go to the hospital. You can also contract medical control, and so that would be a doctor probably at a hospital. You can call and talk to the doc and say, hey, I get this patient. They don't want to go to the hospital. Here's what I think's wrong. And the doc can talk to him and basically explain, look, here's what we're going to do at the ER. We're going to do some tests. My concerns are that you could be having a heart attack, and that could kill you. And so do what you need to do to make sure the patient understands the ramifications of their decision to refuse care. When in doubt, err in favor of the patient.